So, what exactly is hyperkalemia? Well, it's a fancy medical term for having too much potassium in your blood. Potassium's actually a big deal for your body. It keeps your heart beating regularly and your muscles working the way they should. But like anything, too much can be a problem. Hyperkalemia can creep up for a bunch of reasons. Sometimes it's your kidneys. They're supposed to filter out extra potassium, but if they're not working right, potassium builds up. Or maybe you're taking certain meds, like ACE inhibitors or potassium-sparing diuretics. Add in things like dehydration, diabetes, or a heavy diet of potassium-rich foods, and suddenly your levels are out of whack. So, how do you know if you have hyperkalemia? Honestly, it can be sneaky. Some people feel muscle weakness, fatigue, or even notice their heart beating weirdly. But a lot of times, you might not feel much at all until it's serious. That's why routine blood work is super important if you're at risk. Now, let's talk treatment. First off, if your potassium is just a little high, your doctor might tweak your meds, or suggest cutting back on high potassium foods. Think bananas, oranges, potatoes. But if it's an emergency, say, your heart rhythm's in danger, doctors jump into action. They might give you medicines that help shift potassium back into your cells, or even use treatments to actually remove it from your body, like dialysis. Remember, don't try to fix hyperkalemia on your own. It's a serious condition, and you need a doctor's guidance. Stay curious, take care of your health, and as always, if in doubt, check it out with a professional.